There are three basic common nerve problems involving the upper extremity. One is the carpal tunnel syndrome, which many patients just refer to as carpal tunnel, although that's a place in the wrist rather than a condition. Another one is the cubital tunnel syndrome. Cubital is Latin for the elbow, so there's a second tunnel here for a different nerve. And that's a very, very important nerve because it controls all the fine motor movement of the hand and the fine coordination of the hand. And if that nerve is lost, then not only do you not feel anything with your ring and little fingers, but also you can't use your hand effectively, and eventually you can't even straighten your fingers beyond that. So you can't grasp anything. And then there's another tunnel condition that we refer to, and it's called radial tunnel syndrome. And it's in the forearm, right about in that spot of the forearm. And it presents itself as deep aching pain in that area, usually associated with sustained grip, such as carrying a heavy briefcase or a suitcase. If you get to them early enough, many of them can be treated non-operatively. In the case of the carpal tunnel syndrome, if I see a person early enough when they don't have significant loss of feeling in the three main fingers or digits supplied by that nerve, the thumb, index, and long fingers, simple splinting of the wrist at night so they don't sleep with their wrist bent like this and further squeeze the nerve circulation off. The carpal tunnel can be treated either endoscopically, which some people really like to do. I prefer the open treatment, but through a very, very small incision. You might see advertised this endoscopic treatment where they've got this huge long scar that goes halfway down their arm. But actually the open treatment is through a little bitty incision about 2 centimeters, which is around 3/4 of an inch in the palm. I do that usually under simply local anesthesia, just numbing up the area after the person's been given a little bit of intravenous sedation. And that operation is really a little 10-minute small procedure. People recover very, very well from it. One of the best, most satisfying operations that I have.
The pain started coming more frequently. My hands were falling asleep constantly. I would be awakened like every 15-20 minutes by a sudden jolt that felt like an electrical current that was running down my arm. My fingers would be asleep. There would be a lot of pain. My situation was a bit more complicated. Not only did I have arthritis in my hands, I also had some nerve damage.
Hers was about the worst deformity I've ever seen, and by deformity I mean that when the arthritis exists for a long time, the one bone, this bone, actually starts to mechanically just grind the other bone away, and about 40% of the opposing bone was gone. And I just saw her the other day, and she said, "Thank you for giving my hand back."
And now I love it. I love the fact that it's back to where it was before I even started having any symptoms, probably better than it was years ago.